Every safe pregnancy is more than a personal milestone. It's a foundation for stronger families, healthier communities, and resilient nations. Because when she matters, everyone matters. Each year, hundreds of thousands of women face preventable risk during pregnancy and childbirth. Most of this occurs in places where access to skilled care is limited. But maternal health is not just about survival. It's about dignity, safety, and the right to thrive. While safe pregnancy means consistent antenatal visit to detect complications early, skilled birth attendants who can respond to emergencies, proper nutrition to support both mother and child. It is also the postnatal care that ensures recovery and well-being. By the way, the leading causes of maternal death are hemorrhage, infection, high blood pressure, and obstructed labor. These are preventable with timely intervention, yet poverty, conflict, and lack of education often block women from the care they need. And when communities support mothers, outcomes improve. When governments invest in maternal health system, nations grow stronger. Maternal health is not clarity, it is strategy and backbone of national development. In conclusion, every mother deserves a safe pregnancy, while every child deserves a healthy start, and every nation deserves the strength that comes from protecting women's health. Therefore, together we can make maternal health a priority. Subscribe, share, and be part of the Healthy Women is Equal to Health Nation, because she matters. Thanks for watching. My name is Skylar.